What's up, guys? Happy Friday. We made it. We made it. All right, good evening, friends and fellow health enthusiasts. I'm Dr. Joaquin Acosta, your guide on this enlightening journey of Know Your Pharmacist. Welcome to our special live stream this February 2nd, 2024, where we delve into the realms of healthcare innovation and patient empowerment. As CEO of PharmTrue, my mission is to bring you to the forefront of health information with integrity, passion, and expertise. Tonight, we're unpacking a topic that's the cornerstone of effective healthcare, medication adherence. It's a crucial pillar that upholds the temple of health, yet is often overlooked. We'll explore how the elephant in the room affects patient outcomes and healthcare systems, bringing to light the strategies that bridge the gap between prescriptions and their real-world use. But that's not all. We're also taking a leap into the future of healthcare with digital medication adherence systems. Imagine a world where technology and healthcare merge seamlessly to ensure your wellness is always a priority. That's a future we're stepping into tonight. In our Enlightenment Hour, we confront a silent public health challenge: medication non-adherence in chronic disease. It's a multifaceted issue, and together we'll unravel it, understanding its impact and navigating through its complexities. And in our Herbal Wellness Corner, sponsored by High Horse Cannabis Company, we'll delve into the intriguing relationship between cannabis and heart health. It's a topic shrouded in mystery and misconceptions, and we're here to uncover the truth. In our Community Spotlight, we celebrate the heartwarming stories from the Animal Humane of New Mexico. Their dedication to fostering is not just about care, it's about creating a ripple of love and compassion in our community. And finally, in our Men's Health Minute, we address a vital aspect of men's health: understanding cholesterol levels. So knowledge is power, guys, and we're empowering you with the information you need for better health decisions. So stay with me, Dr. Joaquin Acosta, as we embark on this transformative journey. Together, let's reshape our understanding of health and wellness. Let's learn, grow, and be inspired. Welcome to Know Your Pharmacist. Let's begin. So jumping right on in, ladies and gentlemen. Pharmacist Frontline segment, tackling medication non-adherence. Something you may not think about that is absolutely the elephant in the room, guys. So let's do a little bit of discussion on this, guys. So medication adherence, it can have a more direct impact on patient outcomes than the specific treatment in itself. It is estimated that adherence to chronic medications is about 50%. Maintaining a blame-free environment provides patients with praise for goal achievement, is essential for a trusting and effective patient-pharmacist relationship. Effective interventions include face-to-face counseling, mobile text messaging, simplifying medication regimens, and using adherence packaging, minimizing adverse effects, helping with access, and engaging team members. Improving adherence can ultimately generate substantial clinical and financial rewards. Let me tell you more. According to the World Health Organization, medication adherence can have a more direct impact on patient outcomes than the specific treatment itself. Medication adherence can affect the quality and length of life, health outcomes, and overall healthcare costs. Non-adherence can account for about 50% of treatment failures, around 125,000 deaths, and up to 25% of hospitalizations each year in the United States. Non-adherence, failing to take your medication on time and as prescribed, right? There could be multiple different reasons for it. Pharmacists, that's part of our job to discover why aren't we taking our medication, right? Typically, adherence rates of 80% or more are needed for optimal therapeutic efficacy. However, it's estimated that adherence to chronic medications is around 50%. Guys, February is American Heart Month. Today is Friday, February 2nd, National Wear Red Day. Got my red tie on, and we're talking about heart health. Like today's episode, absolutely talking about heart health from the pharmacist perspective on our Pharmacist Frontline segment, brought to you by PharmTrue. We're going to be talking smashing medication adherence as a total theme of today's episode, because this is one of the big ones that pharmacies can keep you honest and accountable with. Your pharmacist can keep you extra honest and accountable, and can improve your health outcomes, decrease the amount that we're spending in our overall healthcare system. But again, the responsibility ends up ultimately falling on you, the patient, or the caregivers, and then the healthcare team that supports this system. So when you really look at it, guys, it needs to be incredibly emphasized. And you really think, hey, transitions of care, this is where we can have issues. So, in terms of addressing the elephant of the room, as the U.S. pharmacist explains, maintaining a blame-free environment and providing patients with praise for goal achievement are essential for a trusting and effective relationship between patient and practitioner. Patients may have challenges communicating adherence barriers to their healthcare team or have difficulty understanding the health consequences of non-adherence. Asking key questions through motivational interviewing is therefore imperative to revealing healthcare challenges, and empathetic listening will assist in arriving at patient-centered solutions to overcoming these challenges. Patient education and ongoing communication are critical for patient understanding and medication persistence, especially with mindful consideration that challenges can ebb and flow over time. I hate to be so brute about something, but you can simply say the facts, which, to most people aren't thinking about at the time, but you get to this one point of, hey, Miss Jane Doe, you don't take, or, Mr. John Smith, you don't take your medications on time and as prescribed. I see you're having issues. If this keeps being a thing with these chronic medications of yours, you are likely to be hospitalized. You are likely to have increased healthcare costs. You are likely to not meet your healthcare outcomes. You are likely, right, to, continue to have lower qualities of life that we know, are things that you do not want. So how can we assist you in making you aware that taking your medication on time as prescribed every day for your chronic health medications, truly significantly, increases the amount of life that you can enjoy. It decreases the amount of money out of your pocket, out of the overall system's pocket. And, it takes a lot to get to those points in terms of creating great systems to contribute to this. But guys, it's important. Look at this study. In a retrospective cohort study, pharmacists provided face-to-face counseling to address adherence barriers to statins. Patients receiving counseling were significantly more adherent at 12 months and persistent with statin therapy at 120 and 365 days. In another study of patients with type 2 diabetes, having more time with pharmacists and individualized education, as well as female gender, were positively correlated with improved medication adherence. Studies of the Asheville Project, a quasi-experimental longitudinal pre-post cohort study in 12 community pharmacies in Asheville, North Carolina, have modeled in-person pharmacist education to improve adherence, ultimately leading to improved clinical outcomes and reduced adverse events and costs. These outcomes were demonstrated for a variety of diseases, including asthma, diabetes, hypertension, dyslipidemia, and cardiovascular disease. So you guys, that patient-pharmacist-provider relationship is truly increasing the amount of awesome health outcomes for patients, guys. Patients on statins that lower that 10-year risk for any sort of cardiovascular event for those who are overweight, those who have a family history of cardiovascular stuff, those whose, cholesterol is a little high and out of control. We'll talk a little more on Men's Health Minute today. We can really take down that 10-year risk of you having a cardiovascular event just by getting you on a statin. If you have diabetes, right? If you have some of these other chronic conditions, statins are absolutely mandatory, but because people don't transactionally feel, hey, some way about a statin, you opt to not take it a lot of the time. And then, we find ourselves 10 years later in the hospital. So just by you talking to a pharmacist, statistically, you're about 43% more likely to be adherent to taking your medications on time, which again is awesome. We don't have studies on a live stream, but imagine, listening to your pharmacist over live stream, understanding that it's a big deal to take your medications for chronic health medications on time and as prescribed. You do that a little bit better. You start beating that 50% average of taking your medications 50% on time as prescribed to 80% and above, increasing your health outcomes. And, you just listened to me for free and you got that value right now. I'm not even trying to sit there and, try to sell you something. This is truly just, Friday, Wear Red Day, American Heart Month, February. It's a big deal. It's important to me. This is something that pharmacists do. It's something that, is part of the DNA of what makes up a pharmacist, and making sure that people have access to their medications, can take it on time as prescribed, that we can look at barriers to taking medications and actually having, good interventions and a close relationship there where we can help with things, we really do one heck of a job there. So my suggestion, my recommendation, my strong recommendation, go talk to your pharmacist, right? Take that time to talk to them, at least, right, once a year for the very least, guys. If you've got some chronic health conditions that you need a little bit better managing of, make a better relationship with your pharmacist. If you're at Walgreens or CVS or one of those things, and you've got a really, really busy pharmacist, try to call them at the off hours. Go squeeze some time and become that one person that your pharmacist knows exists, and they have to, assume their care, make it happen. Squeaky wheels get the oil a lot of the time. And, if a pharmacist is truly lacking some compassion there, then, that's beyond me, right? But anyways, that's my advice for you today, guys, our pharmacist frontline segment. But, as we do talk about the elephant in the room and how you can have effective interventions, guys, for, medication adherence, one of the big ones that I did want to talk about, because, sometimes this is one of those that drives people nuts. And I'm talking about in the next two segments, parts of pharmacy that drive people nuts. So let's talk about it. Mobile text messaging. Anyways, check this out. Mobile text messaging is a key example of an electronic strategy worthy of further exploration. It is estimated that 77% of Americans own a smartphone, up from 35% in 2011. By demographics, around 92% of individuals aged 18 to 29 years, 42% of those aged 65 or older, 89% of college graduates, and 54% of those with less than a high school degree, 93% with an income of 75% or more, and 64% with an income of 30% are less than $30,000 a year, all own a cell phone. So, what we're talking about, yes, everybody has a cell phone. Mobile communication and digital communication is important. And it is very important. It was determining that text messaging doubled the odds of medication adherence, and improved the overall adherence rates by 17.8%. Half of the trials incorporated daily text message, 31% were personalized, and 63% were managed by computer programs. Overall, texting appears to be a promising tool for promoting medication adherence. How great, right? Seems awesome. I think we all know the other elephant in the room here, CVS, right? CVS messaging, CVS receipts. It's so long, it never stops, right? If you opt in for messaging, you're going to get binged, so binged that you're hit with so many ads that you can't even tell what you have ready for you with medication. And that kind of thing drives me nuts. So, maybe some places overdo it, but at the same time, they're some of the only people who even have the tech up to that standard, right? CVS, Walgreens with their apps, Walmart with their apps. Fine, independent pharmacy has these situations and apps and things, but also, personalized care and creating that relationship, sending out those texts with the medications, checking the text, making sure, for medication pickup texts that you are signed up, right? Don't just delete those messages and things. It actually, statistically, even if you hate it, even if you don't think you're going to check in and you don't think it's going to be that good for you, it's going to probably make you take your medications more on time and as prescribed, which is great, which keeps you out of the hospital, which keeps your families out of the hospital, keeps your insurance costs down, gives you better quality of life, those things. So if you want a positive, association to connect all of that to, perfect, right? You will add years to your life. You will save more money by taking your medication on time and as prescribed, especially for chronic health medications, heart medications, cardiovascular month, that falls under chronic disease. Diabetes, type 2 diabetes is a big one, that always gets lumped in here because it's just so big, especially in our area, guys. So, it's a big deal. There's a lot of other methods, like if you guys own independent pharmacies, if you guys are even doctor's offices, digital adherence systems are things to consider finding ways to jump into. It can feel expensive. It can feel like you don't know what you're doing, that you don't want to train people on how to send out, automated messages or refill reminders and, autofills and prescription pickup alerts, right? Prescriptions going to be put back on the shelf alerts. All those things are important because they get people to pick up their medication, your chronic medication. If you've got a bunch of meds at the pharmacy that, you shouldn't be on anymore, get those DC'd out of the system so that you're actually getting notifications on the medication that you take, thus keeping you healthier, better, all set, right? So that's what we're talking about. Independent providers, those of you guys who are still paper and pen and just the phone, we can do a lot better these days. This is 2024, and I think patients, you need to do business with people that are able to support the digital functioning of things. Of course, yes, some people are not so tech literate in these things, but right, most do have access to caregivers. Most of you have the ability to help your loved ones, get more streamlined, because otherwise you're going to be helping them and trying to clean up some big messes, right? Trying to figure out who's on what medication. All of a sudden, when grandma gets sick and you're sitting there trying to go and consolidate her meds and see what she should be on, and all of a sudden she needs that extra help, right? So let's get those things systemized into the apps, into the programs, and help, be on top of it, be proactive. So let's look, guys, Enlightenment Hour today. Speaking of CVS and Walgreens, some of your notorious few, but not even just those guys. Guys, I want to provide a supporting argument for, part of their practices that they do. And so community pharmacy automatic refill program improves adherence to maintenance therapy and reduces wasted medication. So, take a listen to this, guys, because you think sometimes maybe autofill at the pharmacy drives you nuts, or they're telling you need to pick up your medication or whatever, it drives you nuts. And that maybe, by autofilling it, you're wasting meds and these, that, and the other. Well, you're actually not. You're not wasting meds, that's one. And you're actually increasing the chance that you take your medication on time and as prescribed. So medication non-adherence in patients with chronic disease is a central public health problem. Almost half of American adults are prescribed medication for a chronic disease, and there is strong evidence that patients who are adherent to medication regimens experience better health outcomes and incur lower healthcare costs than those who are not adherent. Yet, despite numerous efforts by researchers and clinicians to improve chronic medication use, patients frequently do not adhere to therapy. Medication non-adherence is a multifactorial problem, and numerous interventions have been employed to reduce barriers to appropriate medication use. One response from the pharmacy community has been the development of automatic refill programs. In these programs, patients on prescriptions for maintenance medications with multiple refills are provided a simple mechanism to authorize their next refill before the current supply is exhausted. I.e., when you're at the cash register and they're saying, do you want to sign up your, prescriptions for automatic refills? You check it once and you're in for life, right? Some people dread it. But, I'm telling you, it's actually if one of the crazy things the big pharma machine has invented, this is one of the things that's actually helping people, right? So anyways, when the prescription's refilled, the pharmacy advises the patient that the prescription is ready for pickup at the pharmacy. Although automatic refill programs are designed to promote patient adherence, a potential concern with these programs is that they may contribute to medication wastage by reducing the patient's involvement in the dispensing process. However, a recent systematic review found no evidence to support or disprove this assertion. We evaluated the impact of the automatic refill program in the behemoth, CVS retail pharmacies, comparing adherence and medication oversupply in a sample of patients who enrolled in a refill program with a matched sample of patients who refilled their prescriptions using traditional methods. Takeaway points, guys. Community pharmacy-based automatic refill programs are a strategy to increase adherence of patients on medication for chronic diseases by increasing convenience on medication refill orders. Some have expressed concern that such programs might lead to medication oversupply if not managed properly, right? We found in an evaluation of a natural chain automatic refill program that adherence was significantly increased while medication oversupply was actually reduced compared with the matched sample of people not enrolled. That was across 11 therapeutic classes representing the majority of medications prescribed for chronic diseases. So that's saying, literally just by having your stuff on automatic refill and saying, I'm going to be a really lazy patient about this, more likely, right, over a large point of data there, that you were going to probably be less likely to oversupply yourself and just be on whatever you're supposed to be on. These pharmacy systems are pretty advanced. A lot of the times the pharmacy systems do not let you be on multiple different types of, multiple types of the same medication. So if you're substituting one medication for another, a lot of the system, the times the system will flag that already and will know that one will be DC'd or something like that. So where you start thinking of all the potentials for error, with the pharmacy system in place, you should rather trust that system versus your own style of managing things. Because if that's on a piece of paper, guys, I've talked to so many patients, I've seen so many different ways of people doing it. I've seen, poor little patients that have dementia, Alzheimer's, no family around, that are keeping things on lists that they have all over a house that may not be maintained very well. So, how can we create some sort of intervention and, betterment for that? What works for the greater good? And, I know that's a creepy word sometimes to people, but that's one of those that just, statistically, it may not be the best, most personalized option for everybody, but for the greater good, you are reducing medication waste. You are increasing medication adherence, which reduces burden on the healthcare system, reduces cost. So, all that. If you're refilling your own medications, you have to call the pharmacy every time. You have to log into the app every time to refill. How many times might you forget? How many times might you not do it on time or, a couple days ahead? So you have things in stock, right? So that's why these systems are in place, so that they can, keep you, taken care of. So, anyways, in terms of myths to debunk here in my, Wear Red Day special here for you guys, Pharmacist Frontline segment, medication adherence, huge deal. Cardiovascular meds, chronic medications. It helps reduce hospitalizations. It helps reduce burden on the healthcare system by getting people to take their meds. Most people are taking, 50% of their chronic medications as prescribed and on time. We have to fix that. We have to make that better. Medicare is trying to incentivize healthcare providers for these sorts of metrics. They're penalizing people who do not keep their patients on regimens, who aren't hitting 90-day supplies and trying to keep things on time, not showing gaps in therapy, right? And so, not only do you notice that the systems in the particular businesses in place are now incentivized towards these things, but I'm here to endorse the fact that these things are actually promoting positive steps forward in healthcare for sure. So, don't be afraid of those mobile refill request alerts. Don't be afraid of signing up for electronic communications from your pharmacy to stay on your pace with your medications. Do not be afraid to go talk to your pharmacist. Talking to your pharmacist, counseling and learning from your pharmacist makes you 43% more likely to be adherent to your medications, guys. So if you're doing all that, talking to your pharmacist, you're responding to your texts, picking up your meds on time and as prescribed, you're likely to be really well managed, right? Which sets you up for just a better quality of life. Who doesn't want that? And, simply that. So life comes at you fast, right? Herbal Wellness Corner brought to you by High Horse Cannabis Company, guys. High Horse Cannabis Company just dropped their awesome ounce special for 10 Farms ounces. They are $60 medical and $80 rec for ounces right now while supplies last. Go get that this weekend. You already know to find our Farm True 1-to-1 gummies, baby, over at High Horse 24/7, 365, among many other of our products, guys. But some really, really great promotions happening over at High Horse right now. Arrow batteries back in stock, guys, and all kinds of stuff for your weekend. Valentine's Day is coming up, so go get those farmers infused chocolates. Surprise your loved one with something special, something new, something different, right? Go buy that gourmet chocolate infused with cannabis. This is that time to do that, guaranteed for sure. So anyways, quick one review. We talked about it a little this week, but again, I need to harp on it again, guys. Cannabis, cardiovascular health. How does cannabis affect the heart? Okay, cannabis exerts bidirectional effects on the cardiovascular system. It can increase or decrease both heart rate and blood pressure. Typical doses of cannabis slightly decrease blood pressure and increase heart rate. Cannabinoids can dilate blood vessels, improving blood flow, and animal studies suggest that some cannabinoids could prevent or reduce atherosclerosis, or hardening of the arteries. In rodents, ultra-low doses of THC have been shown to limit the damage of heart attack while preserving cardiac function and promoting faster healing. In general, therapeutic doses of cannabis have a cardioprotective effect, while very high doses of cannabis and synthetic cannabinoids could be dangerous to the heart, especially in patients with pre-existing heart conditions. So in American Heart Month, guys, my advice to you, be careful if you're inhaling THC and you have a heart condition, a pre-existing heart condition, and especially if you're not used to it. Inhaled THC could, if anything, trigger a heart attack or irregular heart rhythms in individuals who are unable to tolerate a drop in blood pressure, increased demand on the heart, or a rapid heart rate. But, this is your few and far between. So, that's your one thing there. Some people really, are saying, hey, can I get off my blood pressure medications and just take CBD and things like that? I've talked to patients like that. No kidding. So no, you cannot do that. And, if you are on medications for your heart and you are going to use cannabis, always, make sure that you get that list looked at, and, perhaps there's a drug interaction there that you need to be aware of, right? So other than that, guys, aside from the adverse events of inhaled cannabis in patients with heart disease, inhaled cannabis again, right? So you're talking one dosage form in patients with heart disease. Some of the compounds in cannabis are protective against cardiovascular disease, guys. We don't know the full effects of it all, but, cannabis, THC is the blissful molecule in and of itself. The anti-anxiety properties do induce that small drop of blood pressure for a little bit, but, after that, some of that relaxation property does help to support a healthy heart. So when we talk about supporting a healthy heart, guys, coming into the weekend, social interaction, great for your endocannabinoid system with or without cannabis. Meditation, yoga, exercise that you enjoy. Not exercise you don't enjoy. That's important, right? So acupuncture, not something that you can just look up a YouTube video and do, right? But all those other things you can do this weekend for free. Whether it's a YouTube video that you do to, do yoga, right? But, or meditation, you can do it all. Social interaction, you guys know how to do that, right? Maybe don't go to Walmart, but you already know, that helps your heart, right? And cannabis is heart healthy for the most part. It's not, anything to be scared of for most users there. So another thing I was talking about last night, guys, just been driving me nuts lately. I had to post about it that, cannabis coming up in the headlines lately for psychosis, for schizophrenia, just a big mess, part of the anti-push against cannabis, guys. But, the number needed to prevent of cannabis users, you'd have to stop 2,800 people from using cannabis, and your heavy cannabis users from males aged 20 to 24 to prevent one male from the ages of 20 to 24 to not get schizophrenia. So in terms of causation and correlation, guys, come on. Insane. So anyways, just know when you see those headlines, cannabis psychosis leads to bloody murder, that is driving up my blood pressure, and I thus have to, meditate my blood pressure back into a calm state there. Otherwise, I just get really frustrated. So, those are just lies, blatantly using media to continue the stigma. Anyways, I'll get off my high horse there. See what I did there? Okay, guys, got one for you in the Community Spotlight, brought to you by the Big Chicken Farm. Foster Friday with these heartwarming images of Minnie being the perfect little mother to her little marble. That's a tongue twister there, huh? Adorable duo arrived at Animal Humane the day after Christmas when Marble was only a week old. They were both taken home to one of the generous foster caregivers so that Minnie could take care of her puppy in a peaceful and nurturing environment. When you foster, you get a front row seat to life's some of the most beautiful moments, guys. Check out the Animal Humane of New Mexico if you can do a little bit of fostering there. Very sweet Minnie and Marble cuties there, right? For sure. Oh man, did I not get the screen popped up? Sorry about that. Let me get that for you. So let's look. Okay, Minnie, Marble, boom, boom. Cutie patooties, yep. Mother Nature, something beautiful. We are all, God's creatures. This beautiful green earth. All right, guys, now I'm done tugging at your heartstrings. Let's talk about your heart one last time. And guys, I'm talking to you. Women, yes, you too. But, okay, guys, in our Men's Health Minute, it's simply going to be a minute. Check this out. Have you gotten your cholesterol levels taken? Have you, when was the last time you had that assessed? We need to get those things looked at, guys. Cholesterol not only maintains the fluidity and integrity of cell membranes, it's the precursor of steroid hormones and helps your body synthesize vitamin D and bile acids, but it also, too much of it, especially too much high LDL levels, can increase your risk of stroke, heart attack, and coronary artery disease. The good protein, or the good, cholesterol markers there, your HDL, high density lipoproteins, are made up of good or happy cholesterol. So in terms of normal cholesterol levels for men, let me pull this up for y'all. Just take a good look. I hope you can see it. Males aged 19 and younger, total cholesterol less than 170, non-HDLs less than 120, HDLs more than 45, LDLs less than 100. Men aged 20 and older, total cholesterol between 125 and 200. Non-HDL cholesterol less than 130, HDL cholesterol 40 milligrams per deciliter or higher, and LDL cholesterol less than 100 milligrams per deciliter. In terms of borderline, guys, if you're in that 200 range for total cholesterol at any age, you're already borderline. If you're above 200, you're super borderline, right? HDLs, you don't want to have higher than 60, and LDLs, higher than 130 or 160 to 189 gets you, coronary artery disease, stroke, hypertension, peripheral artery disease, and type 2 diabetes. So in terms of looking at labs and markers, just go get that blood work done, see where your cholesterol stands, cross-reference that with, your weight, your activity levels. If you're plus 45, go get a prostate exam, or prostate PSA done in this as well. If you're up above the age of 30, go check for andropause, check your hormones. But on top of blood pressure, men, go look at some of these silent killers here, which are your HDL and LDL, levels there. So, all right, it was longer than a minute, guys, and we're done. If you have any questions, let me know. Shoot me a message. I'll get to you when I can. Much love. Have a great weekend. Stay happy.